Hello, I am Jan Butz from the Genealogies of Knowledge Research Network, and this is the 7th video of an 8-part interactive series on analyzing patterns and concepts in the Oslo Medical Corpus. In this video, we discuss interactions between different concepts. Concepts do not function in isolation. They are always embedded in a larger network of relations, and this means that corpus analyses often take more than one keyword into account. Partly, concept relationships mirror concrete connections between objects or phenomena. There can hardly be a coast without a plot of land and a body of water. Yet conceptual connections are also reflective of human experiences and expectations. You can associate the coast with romance, labor, or rising sea levels depending on cultural influences as well as personal concerns. Language can accentuate or consolidate particular relationships while obscuring others, and it is your task as a researcher to take stock of the worldview that makes a body of text appear coherent. Let's look, as an example, at a very common conceptual connection within the OMC, namely that between morbidity and mortality. Whenever morbidity is mentioned in a text, there is a high chance that mortality will follow. The mosaic will reflect the strength of this connection. Mortality is much more common in the corpus though, meaning that it often functions without its conceptual counterpart. When we consider mortality in isolation, another pair of collocates gains in strength, namely rate and rates. You will find the same collocates for death. Death is undoubtedly a very concrete real-world phenomenon. A death rate is no less real, but also indicates a particular perspective on life's end, namely that of measurement or quantification. In a corpus composed of religious texts, we would be highly likely to find other collocates surrounding mortality, for instance, the soul, a concept that is barely present in the OMC. Statistics and spirituality are not mutually exclusive and each have their place in how humans tackle problems. The point is not then to critique the fact that medical texts adopt a particular perspective, but rather to point out that patterned connections between concepts can indicate how that perspective takes shape. Let's clarify this further with another example. Look for the word care in the corpus. It occurs in the corpus thousands of times, but across all these occurrences, clear connections can be observed. We find many mentions of care services, care facilities, care workers, care settings, care providers, and care professionals. The strongest collocate, however, appears on the left-hand side: health. If we perform a new search for healthcare, we will find a different but similar set of combinations, such as healthcare staff, healthcare providers, healthcare workers, and healthcare services. It should be clear from those collocations that there are at least two ways of looking at care, from an institutional and from a human perspective. Sometimes, as in healthcare providers, both these perspectives merge. The human and the organizational factor complement each other, but in what context does one of them take precedence? What are, in other words, common ways to think and write about a healthcare system, and does this system differ from the care system and from the health system as conceptualized in the corpus? You will notice at this point that you cannot do everything at once. Since concepts operate in clusters, you need to explore a variety of patterns, and there are only so many things you can keep in mind simultaneously. It's therefore a good idea to document your searches. If you open the menu in the OMC interface, you will find the option to download concordance. This will save your search results in a file, which you can later load again. In the meantime, you can perform as many queries as you like without having to worry about losing track. Let's say, for instance, that you are interested in the concept of gender, and you find the following excerpt in the corpus. Gender norms in many cultures, including binary concepts of gender and taboos about sexuality, also perpetuate stigma, homophobia, and transphobia. Lesbian, gay, bisexual, transgender, and intersex persons and marginalized women, such as sex workers or women who use drugs, who fear judgment, violence, or arrest, struggle to access sexual and reproductive health services. The statement is explicitly concerned with conceptual relations and contains many words whose meaning is heavily contested, such as gender itself. To map how this cluster functions in the corpus as a whole, you will have to perform a series of searches, and each of them may point towards new avenues to explore. How common, for instance, is the abbreviation LGBTI? And does it compete with other initialisms, such as LGBT or LGBTQ? Does the choice of abbreviation tell you something about the positioning of particular authors and organizations, or can variation simply be ascribed to a temporal factor with the list lengthening as the years pass? As you take stock of conceptual relations, such questions will accumulate, and while a corpus in this sense can be a gift that keeps on giving, at some point you will also have to stop. More on this in the next and final video.